We're going to kick off this this Zoom now. First off, I'd like to welcome everyone that's joining us today on this Zoom. My name's Kevin. I'm going to help facilitate some of the Q&A between you guys out there with Dr. Anthony. We're going to learn a little bit more about RexMD and the prescription medications that are available on their website. Without further ado, we're joined by Dr. Anthony Puopolo, Chief Medical Officer, who's going to help answer some questions our viewers may have about the telemedicine process, as well as questions about RexMD medication options. We'll learn a bit more about all this and get his insight on how RexMD is helping thousands of men every week with treatments. First off, thank you, Dr. Anthony, for joining us today.
Thanks, Kevin. It's great to be here.
Great. You know, to start, can you share just a bit about your medical background?
Sure. I started initially as a psychiatrist in the U.S. Army for 9 years, and then I followed that up in private practice as a primary care doctor for over 2,500 patients on my panel, and a full-time urgent care doctor for a total of about 10 years. I was also owner of an integrated wellness business, which dealt in treatments that of alternative medicine type, specializing in herbs and supplements. So I'm an expert in that area. And then the last 5 years, I've been in the telehealth field and been very, very happy, very pleased to be there.
Great. Can you share a bit more about telemedicine? What exactly is telehealth and telemedicine?
Well, telehealth is the treatment of patients virtually, and you can get virtual consultations, prescriptions from our pharmacy direct to your door. It breaks down a lot of the barriers that I saw practicing medicine in person, be it trying to get an appointment, the cost of an appointment, the time you have to take off work to drive there and be in a waiting room, and so many other things that are, eliminated by telehealth, which really provides, cost-efficient, convenient, simple care, cutting out a lot of the, waste and cost in the system. So it's been awesome being a part of it.
So RexMD handles specifically telehealth for men, and I understand ED medications are one of the most popular prescriptions that you help prescribe men.
Right.
In your opinion, why do so many men need ED medications as they age?
Well, in order to get and maintain an erection, you need to have proper blood flow to the penis, and you need to have healthy nerves that supply the penis. So as we age, just like with any other system or function of the body, the blood flow to the penis diminishes due to normal wear and tear. Plus, as you get older, you're more likely to have diseases that affect the blood flow to the penis, be it high blood pressure, high cholesterol, diabetes, heart disease, stroke, Parkinson's disease, and many others that affect the ability to, obtain and maintain a adequate erection to, have satisfactory sexual enjoyment and function.
Gotcha. And we'll get into the specifics on medication here in a minute with some of the questions that are coming in. But I think one of the big ones that is just everyone wants to know, does ED medication really work for most guys?
Yes. The actual rate of success using ED medications is 80%. And that's a general number, but it's pretty accurate. So it's hard to find another medication that works so well with, if prescribed properly, can have, be so safe at the same time. I also just want to get back to one thing about ED as we age, just a number for people to keep in mind, and maybe to normalize it for some people, because I know some people feel like, oh, it can be a sensitive subject. 50% of people by 50 years old have some degree of ED, erectile dysfunction, and 70% by 70 years old. So you're not alone if you're having some issues as you age. But
So these are pretty widespread numbers for men in America.
yes, it's pretty common. And one thing that was what I saw in in-person medicine that I previously practiced is it was undervalued a lot of times. Whereas, it would maybe at the end of the visit, you mentioned something about it. The person might not even mention it to you because they're embarrassed about it. And if everyone got through all the barriers of making an appointment, paying for the appointment, taking time off work, getting the courage up to mention it to their doctor, then often it wasn't covered by insurance. So sometimes the pills would be $40, $50 per pill. And places such as the VA where I worked, the number of pills were limited, sometimes to like 2 a month if they were paid for. So.
Gotcha. Now, if it's all right with you, there's some questions coming in from the viewers here today that are learning a lot from you and about Rex.
Mhm.
How about we jump in and
Yeah,
try to answer a few?
definitely.
Let's
Go.
see. Here's a question from John. When you take an ED prescription pill, does it work right away?
John, that's a good question. It's always, you're always wondering, is this going to help me at all? I went through all the, time and effort to get the pills. Yes. Usually within 1 hour after taking the pill, you'll be able to maintain, you'll able to get an erection. Here's an important point, that just because you take Viagra does not mean, or Cialis, does not mean that you're going to get an erection automatically. There has to be stimulation. So if you take the medication and there is no stimulation, you're not just going to get an erection for no reason. So sometimes people think that as well. That's not the case.
Gotcha. Here's another one that I think you just touched on that a lot of guys want to know. Viagra versus Cialis.
Mhm.
What's the difference?
Yeah, I like to use a baseball analogy for that. Whereas Viagra is more of your closer, if people know about baseball, which is the guy who comes in at the end of the game for a short period of time, maybe an inning or two, has a strong fastball, might be a little wild, because it tends to be stronger than Cialis. It doesn't last as long as Cialis, and there's maybe a little bit more in the way of potential side effects, or there can be. But for Cialis, you're more of your starting pitcher. It not quite as strong, doesn't throw as quite as hard of a fastball, but more lasts longer, and maybe less in the way of wildness and side effects. So the Viagra, just to give you timing, maybe lasts about 4 to 6 hours, whereas Cialis maybe 36 to 48 hours.
Understood. Yeah. And, for a gentleman that's taking Viagra, maybe for the first time, how might, that night out, play out? When should it be taken? When should he be prepared?
Yeah. So what I like to describe it is Viagra is more for, say, a date night where you take the pill just before you leave the house and on an empty stomach, ideally, and you're covered for that evening. Whereas Cialis would be maybe a weekend getaway with your significant other, where you're not quite sure if and when there'll be sexual activity, and you take the Cialis on the drive up to the getaway, and you'd be covered for that whole weekend.
And are there any side effects that a guy might want to watch out for when taking the medication?
Yeah, that's why it's important to, be prescribed the medication through a company like RexMD, because there can be side effects from the medication. If you go through our system, you'll fill out a patient questionnaire. We'll learn a lot about you. We'll make sure that you're given the right dose and right amount of pills and correct directions for your needs. And if that's the case, you go through XMD, that typically you can expect most cases no side effects, occasionally mild side effects like maybe headache or stuffy nose or facial flushing. A lot of times it's short-lived, and it might be an indication that the medication's working and then wear off. So it kind of lets you know that it's kicking in, if you will. If taken improperly, in the wrong person with certain diseases or at a certain age, your side effects can even cause heart attacks or strokes or be fatal. So it is important and that's rare, but still it's something to be noted. So it is important you get it from the right source. But if you do that, you should be fine.
And there's a question that popped up from Dan that might be related.
Okay.
His question was, is this medication okay to take for a type 2 diabetic?
Thanks, Dan. Yep. Thanks for the question. That's a great question. People ask that all the time. There is we'd have to, for you, Dan, we'd have to get more information about your situation, like if your blood sugar is under control. We typically ask what your A1C is. If you don't know what that is, that's your 3-month measure it's a measure of how controlled your diabetes has been over the last 3 months. And so we take everything into account, but the short answer is yes, you can take it. I prescribe it all the time to people with diabetes. Sometimes we'll start at a lower dose, depending on your age and your other factors, but diabetes is definitely not something that will prevent us from prescribing Viagra or Cialis.
Here's a question from Bill. Is there a big difference between brand name drugs and the generic version? He goes on to say, I understand generics save guys a bunch of money, but what's your opinion on effectiveness?
It was Bill, right? Bill?
It was Bill.
Bill asked that. Yeah, yep. Bill. Thanks for the question, Bill. Viagra and Cialis were under patent for a long time, so there's a lot of people who got used to the brand names because generics were not available. And I've seen most people who switched from taking the brand name to the generic do perfectly fine. There's a minority, I would say, of people who feel like it's not as effective or may attribute a side effect or two to the generic. My advice is, in general, they should work pretty much exactly the same. So if you're a first-time user, I don't think you'll know the difference. And even if you're switching, I think in vast majority of cases, you won't notice a difference.
Gotcha. And here's one from Matthew. I'm 32 years old and have some ED symptoms and would like some help in bed. Am I too young to try ED medication?
Yeah, Great question. Um, I don't have an age limit for ED medications. I mean, other than, being an adult, right? So we talked about as you get older, you have age going against you in terms of blood flow in the nerves, but also diseases come on more with age, right? But in younger people, the problem tends to be stress. Now, stress by itself can decrease blood flow to the penis. So that's typically what we're dealing with younger people is mental health, stress-related issues. And what happens is I say jump on the problem early because it can become a self-perpetuating negative cycle, downward cycle. If you don't treat it early, you can get performance anxiety from poor performance and then, avoid sexual activity, and it can affect relationships. And I say get on it early with a trial of Cialis or Viagra because it's very safe, particularly the younger you are. So the answer is I wouldn't wait to get treated if I was a 32-year-old male with a problem.
And here's a quick follow-up question that came in earlier, but it also related. What's the age range you see when prescribing ED medication?
Mhm.
Seems like these medications work for men of various different ages.
Yeah, I think that kind of ties into the last question. Yeah, there is no age. I mean, that includes upper limit. I don't have an upper limit of age. I take all factors into account, and what's more important is the health of the person than the age in terms of prescribing. So, like I said, at the younger ages, it's more tends to be more of a ED is due to more mental health, stress-related issues, and older and more age-related decline and disease-related issues. And all ages, potentially another thing that can factor in, just to kind of round it out, is medication use, right? Certain medications can contribute to ED, particular ones for blood pressure control and for depression and anxiety, as well as substance use can affect erectile function. Smoking cigarettes, alcohol, recreational drugs, marijuana, cocaine can all negatively affect erectile function. So, and that affects all ages, of course, potentially.
And here's one from Ryan, which I think you've just addressed quite a bit of. What kind of medical questions are asked to get a physician to approve a prescription?
Right, right. So Ryan, thanks for the question, Ryan. Kind of all the things I addressed. So it's going to be more of a targeted questionnaire towards those issues: mental health and stress, substance use and abuse, medical issues, of course, your age, medications. Yeah, those would be the main factors we and just to note, big red flag. If you take nitrates, uh, we cannot prescribe Viagra or Cialis to people taking nitrates. Just can't do it because we talked about blood flow to the penis and the nerves. How it specifically works, Viagra and Cialis increases nitric oxide in the penis. Nitric oxide increases the blood flow directly. And you see in the name nitric, it has nitrate, nitric in the name. So if you combine nitrates with nitric oxide that's increased due to Viagra or Cialis, you can cause a dangerously low blood pressure, potentially leading to heart attack and stroke. So that is that. If you are taking nitrates, I probably would go to your primary care or urologist to ask about your erectile dysfunction issues. It may not be worth it. It actually won't be worth coming to RexMD for that question because we simply won't be able to prescribe it.
And here's one from Frank. is there a real difference between prescription ED medication and over-the-counter supplements for men's health that someone could get online or Amazon?
Yeah, great question. With my background in training in integrative medicine, I got a fellowship with Dr. Weil in the University of Arizona, owning my own practice in alternative medicine and specializing in supplements and herbs. I can tell you, rather than getting into all the details, I wouldn't look online for your, or I wouldn't look online or over the counter for your erectile dysfunction needs. You'll end up wasting money and potentially having side effects from whatever you prescribe. Now, some people will look overseas for sildenafil or Viagra and Cialis equivalents overseas. All I can say about that is these taken wrongly, these can have some pretty serious side effects. And, you know, we only go to FDA approved and monitored pharmacies here in the United States. So you know what you're getting when you're taking our products, but if you take those potentially overseas products, you don't know what you're getting. You don't know if you're getting actually the active ingredient, and you don't know the safety. So I would avoid that as well.
And I guess I have one for you. Do patients ever reach back out to you, thanking you for maybe saving their marriage or a great night out?
Yeah, I mean, when I was a psychiatrist for 9 years, a practicing psychiatrist, I would do marriage therapy, and one of the mantras was, you know, a lot of the, you know, good sex life in a marriage is a good marriage usually, and you know, bad sex life is an indication of a bad marriage, and sometimes it's chicken or the egg. So it's hard to tell which came first. So, um, you know, getting that right is key. And I had numerous cases where we got the sex life right, and then the marriage followed in terms of health and coming back from the brink of breakup and divorce. So, you know, that happened more than once. Say.
Got it. Well, we'll get back to the questions here in a second. Actually, someone on the Zoom spotted it, but there is a promo code on the screen here for 25% off. If you go online during Dr. Anthony's Zoom discussion here, use the promo code on that screen. Try today 25. You'll get 25% off your prescription medication. This offer and this promo code is going to apply to new patients only. So again, if you're considering trying Rex, now's a pretty good time to save some money as a new patient. Let's dive back in if you want to field a few more.
Sure, of course.
Here's one from
It's
Chris.
my
What if the
pleasure.
medication isn't effective? Can I adjust my dosage easily?
Yeah, great question. You know, in order to get a prescription from RexMD, there's a process that needs to happen in terms of giving us your information, having a doctor review that information, and determine the proper dose and directions and for you. So once that decision has been made, and 9 times out of 10, we'll be able to give you what you've requested. But you know, once that decision has been made, the prescriptions that you know, delivered to your door, you try the medication. We do ask you try it for a time, and you know, see how it works. But if it's not working for you, and there's side effects, you can reach out to us at any time. Contact us. We can talk about whatever issues you're having, and we can change the dose and or medication at any point. So yeah, I mean, we usually can find a solution, like I said, in 80% of the cases.
So you can get it right for the cases that need adjustments.
Right. We can.
Here's one from Juan. My ED problem isn't all the time, and sometimes just kind of halfway. What should I do?
Yeah, thanks, Juan, for the question. I think, like I was kind of speaking to before, sounds like you're at the beginnings of a problem, and earlier the better, because there's a psychological component that happens. Like I said, um, you don't want to have that hesitation when you're engaging in sexual activity, whether or not it's going to work out. Um, and so instead of a downward spiral of poor performance um, and negativity, I would stress early intervention, get you on the right path, have a couple um, positive experiences, and then the confidence will rise and it'll be an upward spiral instead of a downward spiral. So that would be my advice. Don't wait. Attack it early. Earlier, the better, and then it'll be easier to treat.
Here's one from Kenny. Is ED medication safe to take every night? How often do most guys take it?
Well, I guess if you can look at it one way, if you're fortunate enough to need it every night, it can be taken every night. You'll get it's a very stereotypical response. You'll get the same result pretty much every time with the same circumstances. And yes, it can be taken every night. And if it's properly dosed, to be safe and effective.
And here's one reverting back to maybe that Viagra Cialis discussion. Sam is asking, can you explain what Cialis daily is and how that works?
Sure, Sam. Cialis daily is, like, to go back to the analogy we talked about before. Um, Cialis is more of the starting pitcher, not quite as strong, but more steady levels in your bloodstream. And so you can be ready to interact in a sexual manner uh, more spontaneously. So you can have that confidence. Um, and it has fewer potential side effects than Viagra. So it's a good option for people who want that slow and steady daily assurance that they are ready to perform at on a moment's notice.
Here's one that popped up from John. It looks like
Mm-hmm.
he's ready to have a night on the town with this COVID nightmare, hopefully ending soon, and maybe dinner
Mm-hmm.
out and some drinks. He asks,
Mm-hmm.
can I still drink alcohol after taking Viagra or Cialis?
John, that's a good question. Like many things in life, moderation in all things, right? So with moderate alcohol use, it's no problem. And so for an adult male, two drinks or less, um, would be fine. If you drink more, if you really binge drink, you do run the risk of, the big risk with Viagra or Cialis is lowering your blood pressure. So alcohol also lowers your blood pressure. So if you have too much alcohol and you combine it with Viagra and you take high blood pressure medications, it's so individually based. You're not going to run into problems if you take with moderate alcohol use in Viagra and Cialis. If you start to get heavy, depends on your situation, it can be dangerous due to the drop in blood pressure.
Here's one from Jim.
Mm-hmm.
What is he asking here? If is overstimulation or pornography an issue? Can it cause ED?
All right, Jim. Yeah, I mean, it's a good question. Overstimulation and pornography. Well, here's the deal with erectile dysfunction, just like any, think of it as a muscle. Whatever you don't use, you lose. So pornography, which leads to masturbation, is totally, in general, actually helpful to prevent erectile dysfunction or to treat it, actually. The only issue that I could say, potential issue that I saw when I was doing marriage therapy come up in relationships with pornography is that there's, there's a lot of exotic situations and highly stimulating situations that are portrayed. And if you are in a long-term marriage, maybe you're not having the same level of stimulation. And so the expectation for your intramarriage or even, your partner related encounters might go up. So it might be harder to stimulate an erection and interest in activity. That's the only thing. But I say as a net overall, pornography and or masturbation is actually a good preventive or treatment for erectile dysfunction.
Here's one from Justin. Can smoking cause erectile dysfunction?
All right, Justin. Yes, smoking can cause erectile dysfunction because anything that affects blood flow, like we said, to the penis. So just like you think of blood flow is the same anywhere. So as you know, smoking can cause narrowing of your arteries to your heart or to your brain. It can cause the same to the penis. So anything that narrows blood flow or obstruction of blood flow, like smoking can do, can cause ED. So the simple answer is yes.
And maybe he it looks like he dropped a follow-up. What chronic health conditions contribute to erectile dysfunction?
Ooh, there's many. If I like to just keep it simple, so you focus on blood flow and the nerves. So anything that affects blood flow to the penis or the nerves that affect the blood flow and release of nitric oxide to the penis to increase blood flow. Anything that affects those will potentially direct erectile dysfunction. Now, your list would be anything that, the list would be high blood, just a list of things that affect blood flow: high blood pressure, high cholesterol, diabetes, things that affect nerves. Diabetes affects nerves, stroke, Parkinson's disease, multiple sclerosis. Also, interestingly, smoking, which affects blood flow. Heavy alcohol use can cause erectile dysfunction. Recreational drug use can do it, like marijuana or cocaine. Like you said, these aren't diseases, but medications as a side effect to certain medications. Another interesting disease or problem is low testosterone in terms of hormones can lead to it. So low T testosterone is produced by the testicles and causes masculinization for males. So low T, as they call it, can contribute to erectile dysfunction. That's another one.
And I think
that's not everything, but that's
yep.
A lot of
I think Mark had a valid question, probably related to the world we're living in. What about stress? Is stress a cause of erectile dysfunction?
100%. A stress. So in order to have proper blood flow and nerve function to the penis, you have to have something called the parasympathetic nervous system be activated. And when is that activated? That's activated when you're meditating, when you're relaxed and alert, peaceful, calm. We used to call it rest and digest. So after a nice meal. So these things lead to maximum blood flow. what affects the blood flow negatively is when the sympathetic nervous system is activated. That's called fight or flight. So that's when you're anxious, nervous, stress in your life, worried about getting an erection because you've had problems with erection before. Uh, so fight or flight causes constriction of the blood flow of the penis, because if you think about it, if you're stressed out, that's not the time that nature and evolution wants you to be reproducing. They want it's set up to have people who are calm and relaxed and adequate nutrition and not particularly overweight. That's what's selected for, right, to reproduce. So the opposite will lead to, so the simple answer is yes, stress causes tightening of the blood flow of the penis and erectile dysfunction.
We've had a few new folks visit us, but a reoccurring question that you touched on, if you could hit it again, is what age group is most likely to be affected by this, and can young guys get it too?
Yep, great question. Sorry for repeating myself to people who've been here since the beginning, but it's worth reiterating. By 50 years old, 50% of men will have some degree of erectile dysfunction. By 70 years old, 70% of men. So it's pretty prevalent, but it also occurs in people under 50 for sure. I've prescribed medications to people as young as 18, because in the younger groups, whereas you can have, medical diseases or side effect of medications is common, like antidepressants is common in that group. But the main issue would be mental health issues like stress. And like I said, you want to get it early to prevent a downward spiral in performance, right? You worry about it, you avoid sexual activity because you haven't had a good experience, and that just goes downhill. So you want to get it early. It's very safe in young people. It works really well, and so there is no age of adult that I won't prescribe to in the right circumstance.
Here's one, as a married man, I could relate, from Rob. Not getting sex on a normal basis, could this cause erectile dysfunction?
Yes, Rob, good question. Go back to the mantra, whatever you don't use, you lose, right? So getting erections on a more consistent basis and going to ejaculation is a way to exercise your penile muscle, if you will. So the opposite will lead to weakening of that muscle and potentially ED. Sure.
And here's one from Steve. Looks like he was considering going to see my doctor. Why use Rex instead of going to my in-person physician?
Good question, Steve. From my experience, now 25 years in the medical field, as a doc, first 20 in-person doctor, now last 5 years virtual doctor. There's so many barriers to care for in-person physician, starting from waiting to get an appointment to being last on the list of things that doctors want to cover in person, to embarrassment of the patient to mention that they have a problem, to insurance not paying for the medication, the pills being potentially $40 to $50, or in the case of the VA, maybe the number of pills approved being 2 per month. um, to doctors not taking it seriously. Um, whereas I take it very seriously. I've seen many, negative consequences from erectile dysfunction for relationships and self-esteem and confidence. And so I'd say if you want a cost-effective, convenient, simple, direct, safe way to get this problem solved, use RexMD. If you want to go try your luck with an in-person doc, go ahead. It may work out for you, and that's great. Just want the problem to be solved.
Gotcha. So, Dr. Anthony, you seem to be pretty passionate about what you're doing now, specifically in telehealth. What do you love about what you do and working directly with patients through this telemedicine and telehealth?
Well, Kevin, you're exactly right. I feel like telemedicine is the now and the future. And why? It's just those things. A lot of the things that I just mentioned about in-person doctors versus virtual doctors is everyone's happy with telehealth. The doctor's happy because I get to treat hundreds of patients a day instead of tens of patients, and in a cost-effective, convenient, simple way. Patients love it because they get treatment from their home or from their work, and they can go directly at the problem that they want to address. They don't have to beat around the bush. They don't have to see what the doctor is interested in talking about. They don't have to say, "Oh, I forgot to mention that to the doctor," when it was. Sometimes people don't even mention what's the most important thing, like erectile dysfunction and other mental health issues that are pressing and have huge effects, but don't get treated properly. So I just love it because I'm helping more people. Simply put, I'm helping more people every day than I was before, and the patient satisfaction is way up, and so is mine. So yeah, I'm really happy to be in this space.
Gotcha. And here's just one more, and we'll probably wrap it up here in a minute. But question from anonymous: will your erection go away like it normally does after climaxing?
Good question. Yes, simple answer is yes. I mean, depending on your medical condition, uh, you know, very rarely, very rarely, you know, and it's so extremely rare that it's probably not even, burdening people's minds with. There can be something called priapism, which is an erection that's lasting longer than 4 to 6 hours, which is a medical emergency. Of course, that needs to be seen in an emergency department, and it can be treated by a urologist. But that's the very, very, very rare case. So, for a vast, vast, vast majority of people, it is not an issue. After you have an erection and reach climax, it will you'll become flaccid. But the thing to note with Viagra or Cialis, your refractory period, which is a period between one erection and the next, does shorten. So you'll be able to get another erection, a second erection, a lot faster.
Well, Dr. Anthony, we really appreciate you taking the time to do this today. This was going to be a first of many, as I understand. Guys have a lot of questions that have gone unanswered for a very long time, and helping with these issues can be really beneficial. I wanted to thank you for your time. Some really great info about, a subject a lot of us guys don't talk much about.
Yeah, my pleasure. Let's do it again, Kevin.
For sure. And guys, listen, if you'd like to try RexMD, remember to use the promo code on your screen for 25% off. It's in the lower left corner there. Try today 25. Again, this discount's only going to apply to new patients. If you have additional questions or you'd like to talk to one of the representatives live, the number's there on the lower right-hand corner of your screen, and they'll be able to assist you as well to get started with your telehealth visit. So to wrap it up, thanks, Dr. Anthony, and thanks everyone for joining our Zoom today.
Take care, everyone. Thanks for coming.